Every single day, 35 million Americans look down at their legs and see the same thing. Twisted, bulging veins crawling up their calves like purple ropes under the skin. Not faint lines, but thick, raised cords, sometimes so swollen they ache when touched. 1 in 3 people over the age of 50 has varicose veins. Not spider veins, not cosmetic imperfections, but genuine venous insufficiency that gets worse every single year. And here is what almost nobody is telling you. In 80% of those cases, the progression can be stopped and in many cases reversed without a single surgical procedure. No laser ablation, no sclerotherapy injections, no vein stripping. But you will never hear that in a vascular surgeon's office because there is no billing code for teaching you how your own muscles can do what a $3,000 procedure claims to fix. Subscribe to Dr. Waterling right now and hit that like button. We are working toward building this channel on one principle. The system makes money when you stay sick, not when you get better. Every subscriber moves us closer to creating content that actually serves you instead of a revenue model. Let me be direct with you. Varicose veins are not just a cosmetic problem that you should learn to accept. This is progressive venous disease. The medical term is chronic venous insufficiency, and it means the one-way valves inside your leg veins have stopped working properly. When those valves fail, blood pools in your lower legs instead of returning efficiently to your heart. That pooling creates pressure. That pressure dilates the vein walls. Those dilated veins bulge under your skin, and then the cycle accelerates. The more the veins stretch, the worse the valves function. The worse the valves function, the more blood pools. The more blood pools, the higher the pressure. The higher the pressure, the more the veins stretch. This is not a stable condition. This is a degenerative process that worsens with time. And here is what they do not tell you in that 12-minute consultation. Untreated varicose veins lead to venous ulcers. These are open wounds, typically around the ankles, that refuse to heal because the tissue is starved of oxygen due to poor circulation. Once a venous ulcer develops, the average healing time is 4 to 6 months. Some never heal at all. I have seen patients with ulcers that remained open for years, requiring daily wound care, antibiotics, compression therapy, and ultimately skin grafting. A significant percentage of lower limb amputations in people over 60 begin not with diabetes, but with a venous ulcer that became infected and went septic. Now let me explain exactly what is happening inside your legs. Your veins contain one-way valves, small flaps of tissue that open when blood flows toward your heart and snap shut to prevent backflow. In your legs, these valves fight gravity every single second you are upright. Blood travels upward from your feet through a network of superficial veins just under the skin and deeper veins buried in muscle. Every time your calf muscles contract, they squeeze those deep veins, pushing blood upward. The valves open, blood moves up. The valves close, blood cannot fall back down. That is the system working correctly. But after age 50, the acceleration increases. You lose between 1 to 2% of muscle mass every single year. Your calf muscles, which function as your second heart, become weaker and less effective at pumping blood upward. The vein walls themselves lose elasticity as collagen and elastin fibers degrade. The valves, which are just thin leaflets of endothelial tissue, stretch and weaken. When a valve stretches too much, the leaflets no longer meet in the middle when they close. Blood leaks backward through the gap. That backflow, called reflux, increases pressure in the vein segment below. The increased pressure dilates that section of vein. The dilation weakens the next valve down, and the failure cascade spreads from valve to valve, moving down your leg like a collapsing chain. Now, when you walk into a vascular clinic complaining about varicose veins, here is what happens. The doctor performs a duplex ultrasound to map the incompetent veins. You get a diagnosis, you get a recommendation, and in the overwhelming majority of cases, that recommendation is a procedure. Endovenous laser ablation, radiofrequency ablation, sclerotherapy, vein stripping if the case is severe. These procedures work by destroying the damaged vein, forcing blood to reroute through healthier vessels. The bulging vein disappears because it has been sealed shut or removed entirely. And yes, these procedures are effective for what they do. But here is what nobody mentions. They do nothing to address why the valves failed in the first place. Your calf muscles are still weak. Your venous return is still inadequate. Your valve function in other veins is still declining, so the underlying problem continues, and within 5 to 10 years, new varicose veins develop in different locations. Then you need another procedure, and another. I have seen patients who have had 4 separate ablation procedures over 15 years, each time treating a new set of damaged veins, never once addressing the muscular and circulatory deficiency driving the whole process. The system you rely on is not built to prevent vein disease. It is built to treat it after it develops. There is no revenue in teaching you how to strengthen the muscle pump in your calves. Your next appointment will not include an explanation of how to restore valve competence through targeted exercises, and there is certainly no profit in telling you that if you had started these interventions 10 years ago, you might never have needed the procedure you are now being quoted $4,000 to undergo. So what should you do instead? I am going to give you 4 specific exercises that target the exact mechanical failures causing varicose veins. These are not generic leg exercises. These are clinically structured movements designed to restore calf muscle pump function, improve venous valve competence, and reduce the hydrostatic pressure that dilates your veins. And I need to be very clear about something. If you have severe varicose veins with skin changes, if you have active venous ulcers, if you have a history of deep vein thrombosis, you need medical evaluation and potentially professional treatment. What I am describing works for mild to moderate varicose veins in people without complicated venous disease. This supports your body's own circulatory function. It does not replace assessment by a vascular specialist when clinical intervention is required. Let me tell you about Robert, 58 years old, who came to me 3 years ago. He had visible varicose veins on both calves, worse on the right leg, with significant aching by the end of every workday. He was a delivery driver, on his feet 8 to 10 hours daily. He had consulted a vascular surgeon who recommended endovenous laser ablation on the right leg for $3,200. Robert asked if there were alternatives. The surgeon told him compression stockings might help with symptoms, but would not reverse the vein damage. Robert decided to try conservative management first. I gave him the exact protocol I am about to give you. 4 exercises, performed twice daily, combined with 20 to 30 minutes of leg elevation each evening. Within 6 weeks, the aching had decreased noticeably. Within 4 months, the most prominent varicose vein on his right calf had reduced in size by roughly half. After 1 year of consistent adherence, the visible bulging had diminished to the point where he no longer felt self-conscious wearing shorts. He still has some visible veins, but the progression stopped. The discomfort disappeared, and he never underwent the procedure. Now here is your complete protocol. 4 exercises, each targeting a specific component of venous return and valve function. Exercise 1. Heel drops with calf contraction. This exercise specifically targets the calf muscle pump, forcing blood upward through the deep venous system while creating the mechanical vibration that stimulates valve closure. Stand upright with your feet shoulder width apart, holding onto a chair or wall for balance if needed. Rise up onto the balls of your feet, lifting your heels approximately 3 to 4 centimeters off the floor. Hold that elevated position for 2 seconds, feeling your calf muscles contract firmly. Then drop your heels back down to the floor with a controlled but definite impact. Not a violent slam, but a firm return that creates a slight vibration traveling up through your calves and into your thighs. You should feel that vibration. That mechanical stimulus literally shakes the venous valves, encouraging them to close more completely. Perform 30 repetitions at a pace of roughly 1 drop every 2 seconds. This takes approximately 1 minute. Do this twice daily, once in the morning and once in the evening. Exercise. 2. Ankle flexion pumps in elevated position. This exercise maximizes venous drainage by combining muscle pumping with gravitational assistance, reducing the hydrostatic pressure in your leg veins. Lie flat on your back on a bed or floor. Place 2 pillows under your calves so your heels are elevated approximately 20 to 25 centimeters above heart level. Your knees should be very slightly bent. not locked straight. Now, flex your feet by pulling your toes toward your shins as far as comfortable. Hold for 3 seconds. Then point your toes away from your body as far as possible. Hold for 3 seconds. Each complete cycle, flex and point, takes 6 seconds. Perform 20 complete cycles. This takes approximately 2 minutes. You should feel a distinct pulling sensation in your calf muscles with each flex and point. This rhythmic contraction and relaxation pumps blood out of the superficial veins in your lower legs and into the deep system where it can return more efficiently to your heart. Do this once daily, preferably in the evening before bed. Exercise 3. Standing calf stretch with wall support. This exercise targets the soleus muscle, the deeper calf muscle that plays a critical role in venous return, but is often neglected in standard calf exercises. Stand facing a wall, approximately 1 meter away. Place both hands flat against the wall at shoulder height. Step your right foot back approximately 60 centimeters, keeping your left foot forward. Both feet should point straight ahead, not angled outward. Now here is the critical detail. Bend both knees slightly. This is not a straight leg stretch. By bending the back knee, you isolate the soleus rather than the gastrocnemius. You should feel a deep stretch in the lower part of your right calf, closer to the Achilles tendon than the upper calf. Hold this position for 30 seconds. Breathing normally. You should feel a moderate stretch, not pain. Switch legs. Hold the left side for 30 seconds. Perform 2 complete rounds on each leg for a total of 2 minutes of stretching. The soleus contains a high density of slow twitch muscle fibers and small venous sinuses that act as blood reservoirs. Stretching this muscle improves its flexibility and pump efficiency. Do this once daily. Exercise 4. Supine leg raises with controlled descent. This exercise combines venous drainage with eccentric calf loading, which builds strength specifically in the lengthening phase of muscle contraction when the muscle pump is most effective. Lie flat on your back with your legs extended. Slowly raise your right leg, keeping the knee straight, until your foot is approximately 45 degrees above horizontal. You do not need to bring it to 90 degrees. Hold that position for 5 seconds. Now this is the important part. Lower your leg very slowly, taking a full 10 seconds to return your heel to the floor. During that descent, actively flex your foot, pulling your toes toward your shin. This engages the anterior tibialis and calf muscles eccentrically, meaning they are contracting while lengthening. That eccentric load is what builds functional pump strength. Perform 8 repetitions on the right leg, then switch to the left leg for 8 repetitions. This exercise takes approximately 3 minutes total. Do this once daily, in the evening. Now, here is how to structure this into a daily protocol. Morning, immediately after waking. Perform exercise. 1. The heel drops with calf contraction, 30 repetitions, 1 minute. Midday or early afternoon, perform exercise 3. The standing calf stretch with wall support, 2 rounds per leg, 2 minutes. Evening before bed, perform exercise 2. The ankle flexion pumps in elevated position, 20 cycles, 2 minutes. Then perform exercise 4. The supine leg raises, 8 repetitions per leg, 3 minutes. After completing exercise 4, remain lying down with your legs elevated on pillows for an additional 15 to 20 minutes. During this time, you can read, watch something, or simply rest. This extended elevation period allows maximum venous drainage and gives your vein walls time to recover from the day's gravitational stress. The total active exercise time is approximately 8 minutes per day. 8 minutes to address a condition that otherwise progresses into a $4,000 surgical procedure and potentially disabling venous ulcers. Now, let me give you the mechanism of why this works at the physiological level. When you perform the heel drops, the impact vibration mechanically stimulates the vein walls and valve leaflets. Research in vascular physiology has shown that rhythmic mechanical stimulation increases endothelial nitric oxide production. Nitric oxide improves vein wall tone and valve flexibility. That is not speculation. That is documented cellular biology. The ankle flexion pumps in elevated position combine 2 beneficial effects. The muscle contractions push blood out of the superficial veins. The elevation reduces the hydrostatic pressure column, which is the weight of the blood pressing down from your heart to your feet when you are upright. By elevating your legs above heart level, you temporarily reverse that pressure gradient, allowing blood to flow back toward your heart with gravitational assistance rather than fighting against it. The standing calf stretch improves soleus flexibility and function. A tight, shortened soleus cannot contract through its full range of motion, which limits its pumping effectiveness. By lengthening the muscle, you restore its mechanical advantage. The supine leg raises with eccentric descent specifically builds strength in the muscle fibers that contract during the weight-bearing phase of walking, which is when venous return is most critical. You should expect to see initial improvements within 2 to 3 weeks. The aching and heaviness that typically worsen throughout the day will decrease noticeably. Within 6 to 8 weeks, you may observe that the most prominent varicose veins appear less swollen, especially in the morning before gravitational pooling accumulates. Within 3 to 4 months of consistent daily adherence, visible reduction in vein bulging becomes measurable. Some veins may not disappear entirely, particularly if they have been present for many years, but the progression stops. New varicose veins do not develop, and the existing ones stabilize or improve rather than continuing to worsen. Now, there are additional supportive measures that enhance the effectiveness of these exercises. First, compression stockings. These are not a substitute for the exercises, but they work synergistically. Graduated compression stockings, 15 to 20 millimeters of mercury pressure, provide external support that helps the muscle pump move blood more efficiently. Wear them during the day when you are upright and active. Remove them at night. Second, avoid prolonged static standing. If your job requires you to stand for hours, shift your weight from foot to foot every few minutes, or perform subtle calf raises while standing. The worst thing for venous return is complete immobility in the upright position. Third, maintain healthy body weight. Excess abdominal weight increases intra-abdominal pressure, which impedes venous return from the legs. Every kilogram of weight loss reduces that back pressure. Fourth, stay hydrated. Dehydration increases blood viscosity, making it harder for blood to flow through small vessels and return to the heart. Let me address the question that always comes up. What if you already have severe varicose veins? What if you have had them for 20 years? Will these exercises still help? The honest answer is that severe, long-standing varicose veins with significant structural damage to the vein walls and valves will not fully reverse through exercise alone. But even in severe cases, these exercises prevent further deterioration, reduce symptoms, and improve overall leg circulation. They support whatever treatment you do undergo, whether that is compression therapy or a surgical procedure, and they reduce the likelihood of new varicose veins developing in other locations. There is also a critical age consideration here. If you are over 60 and starting to see early varicose vein development, small bulges, visible veins that were not there 5 years ago, this is exactly when intervention is most effective. Your vein walls still have elasticity, your valves are damaged but not destroyed, your muscle mass, while declining, is still substantial enough to respond to targeted training. This is the window between manageable strain and irreversible damage, and that window narrows with every year of inaction. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers, because it will directly shape what I cover in future videos. Now, I need to address one more thing. There are symptoms associated with leg veins that require immediate medical evaluation, not home exercise protocols. If you have sudden onset leg swelling, especially if it is only in one leg, combined with pain, warmth, and redness, that is a possible deep vein thrombosis. That is a blood clot in the deep venous system, and it is a medical emergency because the clot can break loose and travel to your lungs. If you have a venous ulcer, an open wound near your ankle that is not healing, that requires wound care and professional management. If you have skin changes over varicose veins, darkening, hardening, or inflammation of the skin, that indicates advanced venous disease requiring medical assessment. What I have described today supports normal venous function and addresses early to moderate valve incompetence. It does not replace clinical evaluation when serious venous disease is present. Let me give you one more case. Linda, 62, retired teacher, came to me complaining of leg fatigue and visible veins on both legs. She had tried compression stockings and found them uncomfortable. She had been told by her doctor that surgical options existed but were not urgent. She asked if there was anything else she could do. I gave her this exact protocol. She was skeptical but committed to trying it for 3 months. After 6 weeks, she reported that the evening leg heaviness had decreased substantially. After 3 months, the most prominent vein on her left calf had reduced visibly. She continued the protocol. 2 years later, she still performs the exercises 4 to 5 times per week as maintenance. The varicose veins have not disappeared entirely, but they have not progressed. She has not developed new ones, and she never underwent a procedure. This is not magic. This is basic vascular physiology applied correctly. Your veins depend on muscle pump function to return blood to your heart against gravity. When the muscles weaken, the pump fails. When the pump fails, pressure increases. When pressure increases, valves fail. When valves fail, veins bulge. The conventional medical response is to destroy the damaged veins. The physiological response is to restore the pump function so the veins do not fail in the first place. One approach generates revenue. The other requires 8 minutes of your time per day and costs nothing. Subscribe to Dr. Waterling if you found this valuable. Hit that like button. Share this video with someone you care about, a parent, a friend, someone who is being told that surgery is their only option for varicose veins. You may have just given them a real chance to avoid an unnecessary procedure. Your body is not broken. Your veins are not your enemy. They are a mechanical system responding to mechanical forces. Change the forces and you change the outcome. You are not helpless in front of your own biology. You just needed to understand how it actually works. And now you do.